Hey everybody, my name is Jane. I am one of the nurse practitioners here at Hagopian Plastic Surgery. You will either see me in your consult, maybe for some of your pre-ops, post-ops, and anywhere along your surgical journey. If you're here, you're either thinking about getting a brachioplasty or you're getting one very soon and you're doing the right thing and watching this video to get prepared for it. I'm going to go through some recommendations of products, your post-op instructions, what you can do to get prepared. This is supposed to be an adjunct to your other instructions, a lot of the same information, just delivered to you in a different way. So I hope you find it useful, and we'll get started. In your pre-op appointment, we will go over what time your procedure is, what time you will arrive to the operating room, which hospital you'll be at, and we'll confirm that we have the correct procedure that we're going to do for you. In addition to that, we'll go over what compression garments you may need to purchase. For a brachioplasty, we want you to get a compression that is one continuous piece or either clasps and connects in some way that makes it one continuous piece. What we do not want is two arm sleeves that will be two separate. We don't like them for various reasons, including the fact that they are limited with their compression up top, and also sometimes they roll down. So some brands that we are familiar with that are options for you to utilize are Mirena and Lipoelastic. Just be cautious that you are also getting one that goes down to your wrists as well. This compression will be on you for 22 hours a day for 6 weeks. This compression you will also bring with you to the operating room. In pre-op, it will actually stay on your stretcher and it'll get wheeled back with you. You will wake up in this compression. Typically for sizing, we say when you're getting a brachioplasty to go one full size down from where you are measuring at the time before surgery. This compression you'll be in for 22 hours a day for 6 weeks. After 6 weeks of since surgery, you can go down to 12 hours if you like. Sometimes people elect to stay in the compression longer than 12 hours a day after that point though. In your pre-op appointment, we will also go over what medications you already take, what you will continue to take leading up to surgery, what you might have to stop before surgery. A common one that we have to discuss that is taken very seriously in the anesthesia world is a GLP-1 medication. If you are taking those, the directions from right now when this video is being recorded is to stop them at least 1 week prior to surgery. And in addition to that, needing to be on a clear liquid diet the day before surgery as well. And as always, nothing to eat or drink starting at midnight the night before surgery. We'll go over this in further detail in your pre-op appointment. Before surgery, we will most likely prescribe a handful of medications that are typically the same for most people. We will go over what's individualized for you in your pre-op appointment, but essentially you're always going to be prescribed for the most part an antibiotic. Depending on which surgery this is, you'll either take it for 21 days or 7 days. We'll prescribe something for nausea. Typically, we prescribe ondansetron or Zofran. We will prescribe an antibiotic ointment called mupirocin ointment that will go on your incision line. And we will prescribe typically pain medications. This will vary depending on your allergies, what you've tolerated in the past, and we will go over this for you in your appointment. In addition, it's always great to have Tylenol or ibuprofen ready to go in your post-op period. Most of these medications, if you can tolerate taking them, are great to take in addition right away after surgery. These can be taken with your narcotic pain medication. The medications that we prescribe to you will typically get sent to a pharmacy near your house, with the exception usually of your narcotic pain medication, which can't be sent across state lines. So typically we send it to the pharmacy at the hospital that you are being operated on. And either you can have a loved one take your ID and go pick up the medication, or sometimes they even deliver it to your bedside. Other things to do leading up to surgery, you're going to purchase what's called HipaCleanse. This is a pink antimicrobial soap that you will use in the shower, washing specifically your arms down, leading up to surgery, typically starting about 3 to 5 days prior. We also want you to remove any hair in your armpit starting 2 to 4 days before surgery. We don't want you doing it any closer to surgery to avoid an additional infection risk. And you can do this however you normally remove hair, shaving, waxing, nair, anything like that. Some optional supplies that we recommend would be stuff to manage drainage, whether this is chalk pads, puppy pads, a waterproof reusable blanket, a mattress cover, anything like that. Maybe gloves for someone that might be helping you. Also too, a great thing to get would be a shower chair, so you have a spot to sit down in the shower. This is a common place where people will get dizzy and feel lightheaded, so it's always a good idea to have somewhere to sit and also have a loved one nearby. Make sure that you are prepping your house with plenty of electrolyte-rich drinks, lots of water ready to go, and also a nice healthy diet. Your body's going to be burning a ton of extra calories trying to heal this giant wound that we just created on your body, so you have to fuel it appropriately. Now is not a good time to be in a calorie deficit. If you are interested in taking a probiotic, you certainly can. Just take it outside of 2 hours of taking your antibiotic. And we also recommend that you take an iron supplement. If you don't take one already, one we recommend is called Slow FE, and you can take this leading up to surgery and even afterward for a little while. The most common form of anemia is iron deficiency anemia, so it just kind of helps give you a little boost prior to going to surgery. We recommend that you have Miralax and Senna also that you start taking after surgery. These are both going to help with constipation, which will be exacerbated by anesthesia, not moving around as much, and your pain medications. So if you're someone that you know you're prone to constipation, I would start taking these right away, right when you leave the hospital. You can take Miralax twice a day, and you can take Senna twice a day as well. You can also just take them once a day if you're someone that you know you have never had an issue in the past and you want to take it easy and ease into that. What you're dressed with after surgery might change. Along the way, we usually pivot and see what's working best for our patients. But at the time this video is recorded, we're using a gentle, non-adhesive dressing that typically stays in place for about 4 days. This dressing can't get wet, so you technically can't shower until this dressing comes off. For this dressing, you'll keep it in place until you see us or until about 4 days pass. If your post-op appointment is after 4 days, you are more than welcome to remove your dressing and shower, letting soapy water run over your incisions. After the dressing comes off, you will get out of the shower and spray the solution of hypochlorous acid or Bosch. This is a common wound care solution. So if you get the Bosch, you have to pour it into like a little spray bottle. So you're going to spray along your incision. This just helps decrease your risk of infection and also promotes wound healing. You don't need to dilute the solution. You'll just let it dry and seep into your skin. Once it does that, you will put a thin layer of mupirocin ointment along your incision, and then you'll cover it with a non-adhesive pad. This can be the brand name Telfa or just the generic non-adhesive pad. You'll keep doing this until everything has like a nice good closure. You're noticing that scabs are forming, and then you can switch to using Aquaphor instead of mupirocin ointment. Your sutures won't dissolve until 6 weeks. So that kind of brings me into my next point of your activity restrictions. Your activity restrictions are in place to decrease your risk of wounds and complications. So first and foremost, we will usually always be doing a little bit of liposuction with a brachioplasty. So to decrease your risk of a hematoma, no getting your heart rate elevated for the first 3 weeks after surgery as much as you can control. In addition to that, to decrease your risk of a wound, no bringing your elbow above your shoulder for 4 weeks. After 4 weeks, you can start some stretching exercises by walking your hand up a wall and gently stretching out this area underneath. Additionally, you cannot carry anything heavier than 5 pounds, roughly the weight of a gallon of milk, for 6 weeks. Before your procedure, it's a good idea to do a practice run around your home, seeing what might be a challenge for you in your day-to-day life. So you're thinking about stuff that might be a little bit higher in cabinets that you can normally reach, but with your limited range of motion that you won't be able to reach afterward. You might also want some help moving things around, so that way you're not lifting anything heavy. Just try to set yourself up for success as much as possible. By following your activity restrictions, you're decreasing your risk of a wound or a wound dehiscence. But in addition to that, we want you to try to limit how much moisture is in your armpit. This will also perpetuate a wound if you allow it to accumulate. So one thing you can do to limit that is you can put a nursing pad or some sort of absorbent pad in your armpit. You can snake this into your compression. This can be also simply a non-woven gauze. This can be an abdominal pad. This can be Interdry. Interdry is a moisture-wicking antimicrobial fabric. So any of these products that you want to try that you might find works best for you, just to decrease your risk of a wound in your armpit. A common question we get is when you can start using a deodorant again. A stick deodorant, you're not going to be able to use until about 6 weeks post-op. A spray deodorant, you can start incorporating at about 3 weeks. And you want to make sure you're not spraying this directly into your incision. Another common question we get is when you can start MLD, or manual lymphatic drainage, or start utilizing your pump if you have one. And the answer to both of those questions is about 5 to 7 days after surgery. Some complications to look out for with a brachioplasty include a seroma, which is a capsulated fluid collection underneath the skin. Typically, it will happen, if it's going to happen on the arms, around your elbow area, maybe on your forearm as well. Another big risk to look out for would be a hematoma. This is going to look like an extreme bruise, and it's going to feel very firm under the skin. Another thing to look out for, or risk with any procedure that you go forward with, is going to be infection. So what we look for at a brachioplasty is going to be any diffuse redness. So you might have what's called some reactive erythema, a little bit of redness along your incision line, which is normal. If you notice any diffuse redness spreading from your incision line or anywhere else along your arm, if you're having fevers, if you're having chills, if you notice any malodorous drainage or pus draining from your incision lines, you're going to want to let us know. When you come in for your post-op appointment, we look at your skin very closely, and what we're mainly looking for are any of the complication signs, but we're also looking for skin necrosis. This is essentially death to part of your skin due to an interruption of the blood vessel that feeds that part of the skin. This is most likely going to present as a dark and dusky spot. Part of the risk of undergoing anesthesia, not being mobile, is also going to be a risk of a blood clot. A blood clot in your leg is going to be a deep vein thrombosis. This is normally going to present as one leg being more swollen, maybe have a skin discoloration to it, and it'll probably be painful upon movement as well. A blood clot in your lungs is going to be a pulmonary embolism. That's going to be chest pain, shortness of breath, or difficulty breathing. And then additionally, like we had talked about previously, wounds. So if you're going to have a wound, it'll typically happen in the armpit due to that moisture, but it can happen anywhere along your incision line. That pretty much wraps up our brachioplasty instructions for preparation and postoperative care. So we will talk about a lot of this in your preoperative appointment, but we wanted to make sure you guys had multiple ways of hearing this information. You could look back and watch this video multiple times if need be, and you also have a reference in paper as well. So let us know if you have any questions. Dr. Hagopian, Mallory, and I are always here to answer anything you guys have. Just shoot us a message on UpDocs, or you can email us, whatever is easiest for you guys, or call the office. We'll see you all soon.